Hey, I'm Dr. Bob with the Mason Method for Natural Childbirth, and in this video I'm going to show you 3 things that you can do at home if you're pregnant and suffering from back pain, hip pain, or sciatic nerve pain. And these 3 tips are the same 3 recommendations that I give to almost every pregnant woman that I treat in my office. And the one thing that I would say first off is that, if you watch this video and you start working on these 3 stretches and you're not seeing any relief, or maybe you're experiencing just temporary relief, I encourage you to consider seeing a prenatal chiropractor and specifically look for one that's certified in Webster technique. Because if they're certified in Webster's, it means that they specialize in prenatal care. Okay, so the first movement is called Sacral Release. And so with this one, you're going to need some help from your spouse or a partner. And what they're going to do is they're going to take the palm of their hand and they're going to apply pressure to the triangular shaped bone at the very bottom of your spine called your sacrum. Now the way that they're going to locate the spot for their hand is that they're going to trace your spine all the way down to the lowest point where your spine meets your hips, and you'll find these 2 round bumps on the end of each side at the top of your hips. So basically they're going to trace your spine all the way down, and there's going to be 2 bumps that stick out on each side. These 2 bumps might be a little tender when you push on them, and they border the outside of this sacral bone. So they're going to trace your spine down, they're going to find these 2 little nodules, these 2 little bumps or dimples that stick out. They might be a little tender, but when they locate those, they're going to take the palm of their hand and they're going to go right in between these 2 points, and they're going to apply some pressure. So they might have to spend a couple of minutes trying to locate these 2 points, and then, if you were to draw a line connecting the 2, that's where you put the palm of your hand. And all they're going to do is they're going to apply firm pressure for 10 to 15 seconds, and then they're going to rest for 10 to 15 seconds. But they're going to continue this process of applying pressure for 3 to 5 minutes. And now when I say apply firm pressure, I would say from a scale of 1 to 10, I would say 10 being the firmest amount of pressure that they could possibly apply. So, they're really getting in there. You don't want that. I would say you want more of like a 5 out of 10. And then during this movement, you should be in a position where, you're typically on your hands and knees. You could be resting over a chair, you could be resting over an exercise ball, but you want to be in this position where your lower back is arched and your butt is actually sticking out. So you want to be in this type of position. And just a side note, this is actually a great movement to try when you're in labor, especially if your lower back is giving you pain. Okay, so that's the first movement. Now, the second movement is one that most people are familiar with, and if you've ever done yoga, it's called the cat-cow stretch. And in this movement, you're going to spend about 5 minutes alternating between arching your back and then rounding your back. Okay, and then the third movement is called Rebozo Sifting, and you're going to need a Rebozo scarf or something similar to this. You can purchase Rebozo scarves on Amazon, but basically you just need a blanket or something similar that's long enough and wide enough that's going to cover your belly. And then the movement is what's called a sifting movement. So at first, your partner is going to lift slightly and take the weight of your belly before going into this sifting motion. And he or she is going to sift back and forth the same way that you would sift flour. So it's almost like a vibration. So this one is one that you wouldn't do until you're into the 2nd and 3rd trimester, is when the baby's getting bigger. But it should feel like the weight of the baby is being lifted. And I will say that this movement is also a great technique to try during labor. It can help ease the pain of contractions. All right, so you're going to want to do this for several minutes. And then to finish up all of these stretches, I recommend working out any trigger points that are in your back or your hips. So a lot of women will use a foam roller to work out the trigger points, but you can basically just use a tennis ball. You can take a tennis ball, and all you're going to do is you're going to lay on a flat surface on your back and roll back and forth over the muscle knots with the tennis ball. Now, the muscle knots, or what people refer to as trigger points, are usually going to be tender to the touch, and usually it won't feel great to roll a tennis ball over these spots, at least at first, but as the trigger points start to release and they calm down, it'll feel a lot better afterwards. So just find as many trigger points as you can and spend about 3 to 5 minutes rolling them out. A common one that most women have is the one on your piriformis muscle which is the muscle at the top of your hip. So it kind of lines from your hip down this way. That's a common one to look for, and it pinches off the sciatic nerve, and that's going to be responsible for pain that can go down into your leg. So be sure to try and roll over this muscle every time you do this. Now, if you're doing these movements and you feel like you're only noticing temporary relief or maybe no relief at all, it means that there's something else going on that's causing your pain. And if this is the case, I encourage you to seek help from a prenatal chiropractor in your area. I've linked a website with all of the Webster trained chiropractors in the video description. Be sure to subscribe to our Natural Birth YouTube channel, where we provide tips on how to have a non-traumatic natural birth that leads to a fast recovery, a healthy baby, and is free of unnecessary medical interventions. Just click the link on the bottom right of your screen if you're on a desktop, or the top right if you're on a mobile device. Best of luck for a healthy pregnancy and a healthy baby.